So one of the things that we have learned, I'll give you a very practical example here from our patient population, is through qualitative research, we learned that on one of our indications for Dupuytren's contracture, which is a hand condition, many patients have slow progression. They get an early diagnosis. They are told that surgery is their only option, which is not true. And they go home without clear guidance on when to come back and seek treatment as the disease progresses and as their hand starts to impair and function over time. And what they end up doing is creating workarounds and basic coping mechanisms in their day-to-day life around the use of their hands. You know, oh, it's not a problem, I work around it, my husband helps me with this, my wife will help me with that. Yeah, I can't hold her hand anymore. And then when you dig in a little bit deeper and you start to understand the emotional aspect of this and how there are connection points in their daily life to daily activities or to loved ones that are dramatically impacted, but they're not actually, they've shoved that down. They're in sort of a denial and coping place. We meet them where they are in those daily activities that they have begun to withdraw from because of their impaired hand, to then remind them that there are non-surgical options and that surgery is not the only answer. And so part of it is really just reaching them where they are when they need the information. These patients are no longer info seekers. They got their diagnosis. They were comfortable with their diagnosis. They were not comfortable with having surgery. And they went home and they learned to deal with their condition. So getting in front of them in everyday lives to remind them of the importance of their hand function and that there is a non-surgical option is really powerful in their patient journey to have them return to a hand specialist and seek care.